to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay. So we're going to start a little bit unusually. We usually, oh, thank you. That's nice to have it on paper. We'd usually go right into our informational updates, but there is something that felt pertinent to do before we get into everything, and that is on the agenda. You'll see item 2 is proposal for committee operating protocols. And so this came out of our summer planning retreat, which we have been doing annually for a number of years, but we didn't do last year because of COVID, and we rebooted it this year. And it was a couple of days of the committee getting together. Usually we'd be setting a lot of goals for the year. This year we focused a lot on how we operate, how we work with each other, with the administration, and how we want to work in the year to come. And so I thought it was a really useful conversation. We had Dorothy Presser from Associate Workshop about a lot of those things, like best practices for working together, for communication, for running meetings. And so I learned a lot, and what came out of that was what's in your packet, which is our operating protocols for the year. So we spent a lot of time talking about what we want to put on paper, and a lot of districts do this, and Dorothy had really good examples from other districts. And so we spent really most of our second day hammering out the details of this. And so for those who are looking at a packet somewhere, I encourage you to look it over. There's 3 headings: how we serve our schools, how our meetings work, and how we communicate. So it lays out a lot of what we do, both for ourselves, to remind ourselves what we want to do and what we're aiming to do and how we want to do it, but also so the public understands how we're going to work together. I wouldn't call it a huge departure from how we've done things over the years. It really is more like codifying it, but there are some things in there that maybe we haven't done that are meant to make us more effective, more efficient, more transparent in what we do, keep confusion and miscommunication down to a minimum. And so I'm just grateful for the school committee's time this summer on this. I thought it was a really good, and the superintendents and the leadership team, Carrie, it was a really good conversation. I think I'm happy with where we got with this. It's not a policy, it's really more of a covenant of how we're going to be together. And so I thought, I'm actually going to read it. Mm-hmm. It's not super long, it's a page, but I thought it would just be good to hear it. Westford School Committee Superintendent Operating Protocols for the 2021-2022 school year. I have it electronically, I can just look here. For the purpose of promoting effective governance and enhancing teamwork, we, the superintendent, and the members of the Westford School Committee adopt the following protocols. Section 1 is how we serve our schools. We represent the needs and interests of all our students in the district, and those needs and interests are primary in the decisions we make. We will foster an environment of trust, respect, and inclusivity, and we will model this in our interactions with one another, administration, staff, students, town officials, and members of the public. The superintendent is responsible for the day-to-day management of the district and for overseeing personnel issues. The school committee is responsible for setting policy for the district, approving the budget, and evaluating the superintendent. We collaborate in setting the vision and goals for the district. Section 2 is how our meetings work. We acknowledge that a school committee meeting is a business meeting held in public, not a public meeting. We will make every effort to ensure that meetings are effective and efficient. We will conduct business through a descriptive agenda that appropriately notifies the public in a timely manner of what will be discussed at the meeting. Each meeting's packet will be made available online prior to the meeting and will contain supporting documents for the business before the committee. The school committee welcomes community members to attend our meetings and to speak on matters within its purview. To promote equitable opportunities to be heard, speakers will be limited to 2 minutes in their comments. The overall duration of the public comment period will be predetermined on the meeting agenda, but may be extended at the discretion of the chair. And the third section is how we communicate. We recognize the importance of proactive communication with the intent of avoiding surprises for either the school committee or the superintendent. If school committee members have significant questions or concerns, they agree to contact the superintendent and school committee chair well in advance of a meeting. School committee members will channel requests for information through the superintendent and school committee chair rather than directly to staff. The superintendent will ensure that each member has equal access to any response the committee committee inquiries. Committee members will refer any important questions or concerns received from members of the community to the superintendent. It is not the role of the school committee or any of its members to resolve individual issues. Members of the public may contact all of the members of the school committee by sending an email to school-committee@westfordma.gov. Please note that emails to and from the committee are part of the public record. Whenever possible, the chair will respond on behalf of the committee. And then it says, by signing below, we recognize the importance of honoring these agreed-upon protocols, and we commit to engage in self-reflection and continued improvement, not only in how we operate, but how we collaborate and communicate with one another. And so, just to highlight a few things, one thing that might feel like a change is that we do have a public, you'll see it on today's agenda, we do have a public comment section at the beginning of the meeting. We're going to limit public comment today to that period. The other business items on the agenda, we will not have public comment, so get your public comment in at the beginning. That's how we've, in the past, had done it. We've tried it different ways, but that's how we're going to go with for now. But the things that help kind of, if you feel like, well, there are things on the agenda I want to comment on, there are a couple things that help with that. One is our agendas are more descriptive. You'll notice this time there's comments under each item, or most items, that give a brief description of what's coming up. So that gives you, the public and committee members, a little more heads up on what we're going to be talking about, and really specifically whether or not there's going to be a vote taken. So I think a lot of people, when they know if there's going to be a vote, so whatever it may be, a new policy, they want to make sure they get a chance to comment before that vote is taken. And it is our practice that any major issue that comes up as a vote would get discussed at 2 meetings. It would straddle 2 meetings, so that the first meeting would be an introduction and a discussion, and the second meeting would be a vote. And that gives the public time to email us and to come to public comment before we vote and comment. And so hopefully that will improve the opportunity for people to communicate with us. The other change would be that we have that new email address that lets the public email the entire committee at once. Sometimes people don't know our email addresses or where to get them. We find that sometimes some of us get emails that are really important that we want, that everybody should see from the public, and so this hopefully will help that. We'll all get the same emails. And we do read those. We really do, and we do take them to heart. And honestly, I personally learn from them. Many times we get comments and suggestions and links and things like that that actually are helpful. So continue reaching out to us via email. We do find that helpful. I think that's all I
If I could
had.
just add that your individual emails do still exist.
They do still exist.
That's not a
First
change.
initial, last name at WestfordCAT.
That's just that's an ease of
Yes.
getting everybody with one address.
Exactly.
Yeah.
Thank you. So with that, I think the plan was to vote on this, adopting these protocols, and then actually sign them so we can have a ratified protocol document. So I will entertain a motion.
Motion to approve the operating protocols for the 2021-2022 school year.
Second.
All in favor? Okay. So that's unanimous. As we move on, I'm going to pass this around for folks to sign.
Go ahead, you start over there.
Sure. If somebody can throw a pen with it and pass the...
If I get the pen back, you can
Go get it.
send
Go
it
get it.
around.
Go get it back.
I want to make sure.
And just so people know, it's got, the superintendent will sign, and then the 7 committee members. And Gloria, we'll get your signature next week, okay? I'm holding it for you.
Thank you.
And we will go on to item 4, informational updates, and we'll start with the superintendent updates.
Great. The first thing I want to do, you have had a chance to meet Pat Lenhart previously at the meeting when we all came together, but she is with us tonight, and I would love to introduce Pat Lenhart, who is our new Director of Finance, and give her a chance to just say hi for a second, if you wanted to come up and just say hi to everybody. She has already been, I know, she's like, this way just people can really see you, you know. Right? So our business office is having quite a change, and Pat's been doing a fantastic job already. I think today when we were meeting with the financial administrative assistants, you said today was day 16, right? Yeah. So it's just been day 16 in here, and we had a great meeting with them today. Michelle White is the Assistant Director of Finance, and she is on day 6 of being with us. And she, Pat comes to us from New Jersey. I forget the name of the district you were. Warren, right, in Warren, New Jersey, which is actually very similar to Westford, and we're very fortunate to have her join us. So just introducing Pat again. So thank you, Pat.
Thanks, Pat.
Thanks, Pat.
She's still here, so that's a good sign.
That's right. That's right. That's right. And she's, yeah, I've been having to tell her to go home too, like at the end of the day, because she's been doing a phenomenal job already, and we look forward to all of the collaboration that we're going to have this year with a fun budget season, right? The other updates that we have is just this week, well, tomorrow and Wednesday is our district leadership summer institute, and we will be at the Blanchard School in the Learning Commons. We have 2 days full of information and activities and discussion based on the book that we're reading together, which I shared with you, which is the 5 practices for equity-focused school leadership. And so your homework, we're reading up to page 33, and then on Wednesday, it would be fantastic, we're going to be broken into a whole bunch of different discussion groups, and I invite you to join us between 9 to 11:45-ish. You're going to be busy, and hopefully you saw, I also sent you a video that I'd love for you to watch before, and we're going to watch that first tomorrow. It's only 11 minutes, and I think you'll find it really useful. So that's, and other than that, we've been fielding a lot of emails, you know, a lot of different questions. I agree with what you said earlier. I think that I find the emails actually very, very helpful. I've tried very diligently to respond to all of the emails. Today, I fell under and was not able. So if any of you are out there and you emailed me today, I apologize, I didn't respond. But previous to Friday, I was pretty much caught up on Friday, I think. So I apologize for that. But other than that, right now, that's really kind of what's been going on.
Any questions from the committee? And Carrie, did you have any updates?
No, Chris and I collaborated
Yeah.
in advance.
Great. Okay. School committee updates. Do we have, I imagine we might be a little lean here since we're just kicking the year off. And we'll talk about subcommittees and things like that later. So we'll be generating more updates very soon with regard to that. Well, with that, we'll move on to the 720 item, the number 5, public comment. So a couple things I meant to say at the beginning. We do have remote participation. So hello to everyone who's watching either via Zoom, where if you're on Zoom, you will have an opportunity to potentially raise your hand in Zoom and speak. And then also people who are watching on WestfordCAT. I will say that I suspect that the audio quality on Zoom is not as good. That's been our experience in the past, just the way the setup is, and we are still tweaking the setup to look for something that works better long term. So hang with us. But if you don't intend to make any public comment, I'd encourage you maybe to switch over to the WestfordCAT YouTube stream of the meeting or to the WestfordCAT website. I think you'll have a better audio experience. And so And then for people in the room, we didn't talk about this, but because of the Board of Health, we do have to be masked in this meeting because of the mandate from their vote last Monday evening. And so I encourage everyone to put your masks on. And if you don't have one, that's fine. The table out in the hall has masks, disposable masks for you to use. So if I could have everyone mask, please, that would be great. Thank you. Okay, public comment. As I mentioned in the you raising your hand for public comment?
Yes.
Okay,
How
you
does it
can.
work? I'm sorry.
Yeah, no, that's fine. You can come up to the table. And I was just going to reiterate what we said in our operating protocols. We're doing 2 minutes, and that's to get through as many people as we can.
Sure, of course.
And just, I think that's all I was going to say.
Chris, also, like at other town meetings, you announce your name and your
Yeah, thank you.
address so that we know who everyone is.
Okay. My name is Melissa Mackey, and I live at 12 Fletcher Road. I wanted to thank everyone here tonight. I have nothing but respect for you guys. I know this is a really difficult time. I wanted to specifically comment on the policy that you'll be discussing tonight, the emergency health protocol. I sat in on that subcommittee meeting and had some time to digest it, and I wanted to comment that I feel like as the policy is written or drafted right now, that it gives a little too much power to the school committee and superintendent to do, you know, really whatever, whenever. It's a very broad policy. And one of my largest concerns for that is that I don't think anyone here on the school committee or superintendent has public health knowledge or experience, and maybe even medical experience. I'm not sure if you do, and please correct me if I'm wrong. But luckily we do have medical health experts that are creating policy, and that's our Department of Public Health, and they are the ones that have created the guidance for the state, and they also worked with the DESE to create the current school guidance that we see in place right now. And I think it's really important that we utilize that experience and expertise. Why should we leave it to the experts? Because sometimes good intentions can have negative consequences. And I think that was really evident last year when we had the option, or the DESE was giving us guidance of 3 feet that was developed with medical experts, and we decided that we needed to do 6 feet instead. And that consequence of that really good intention was that our children missed out on a lot of in-person schooling last year. And it was needlessly, because we did end up finding out that 3 feet was perfectly safe. So I feel as if we are going to have a policy where the school committee and the superintendent can go above and beyond state guidance, that we hold ourselves accountable. And how do we do that? First and foremost, I think the term public health emergency needs to be defined as local public health emergency. And I think it needs to be more clearly defined as well in the policy, so that if the school committee and superintendent decide to go above state guidance, that they will show that our town and local data significantly differs somehow from the state level data. And I'll give an example, which was P-Town.
That's over 2 minutes, just letting you know that.
Okay, I'll
you've
finish up real
too
quick.
close. Okay.
So P-Town, when they had that outbreak, that's a perfect example of when your local board of health or local superintendent and school committee should be making policies that immediately address that concern. And what this is going to do is, again, hold yourself accountable. It's going to relieve political and personal feelings from the decision making. It's going to give transparency to the community. It's going to relieve pandemic paranoia, and it avoids letting fear precede the data. Thank you.
Thanks. Any other public comment from the room? Okay, why don't you come on up?
No, it's okay, you can.
And again, just give us your name and your address. Thanks.
My name's Jennifer Ballou. I'm at 7 Pine Grove Road. And my name's Melissa Richardson. I'm at 11 Weedamoo Way. We're sisters.
Tell with the eyes.
Right? That's all you can tell. So I do have 3 children. 2 of them are currently in Westford Public Schools, and she also has 3 with 2 currently in Westford Public Schools. We are here to strongly oppose the district from implementing any mask requirements. We cannot continue this fear-mongering by keeping our children masked. It's cruel, it's harmful to them emotionally and physically, never mind reducing their immunity to other known viruses like the flu and the common cold. I know you've all heard this because I've emailed you several times on this, but my 9-year-old who has asthma, but never has had anxiety or any panic disorders, started to after she started back full-time in April. With chest pain and difficulty breathing, after ruling out any severe medical conditions by her doctor and specialists at Children's Hospital, they determined it was anxiety. Just days after school was out for the summer and she wasn't wearing a mask at all, never mind 6 hours a day, she had no more chest pain, not one complaint. It's a very, very, very strong coincidence. This is just one case, and I know that there are more, and some of these are more severe than others. And in the high school and in middle school, we can't discriminate these kids that are vaccinated and not vaccinated. The seclusion in this world right now is so bad. We can't do these to these kids. It's just not fair. At this point, with the high vaccination rate and continuously low numbers that Westford has had, along with the low transmission rate in children that we've all known all along, and with the individual schools' commitment to sanitizing properly and keeping our HVAC systems maintained, this should be enough to say that we are just going to be fine. The decision to mask these kids should, and I'm serious when I say this, but it should be left to the parents and their guardians to decide this. If their health is at risk, those parents should decide whether they should keep their children home or not, or masked or not. If teachers want to wear masks, let them wear masks. If children want to wear masks, that's up to their parents to decide. This virus isn't going away. Unfortunately, it's not. If you're waiting for things to get back to normal, unfortunately, I think this is the new normal. They have to go. The masks need to go. I can barely breathe. I'm here for 5 minutes. Thank you.
Thanks. I had someone up here, and then I have a hand back there,
I think you have someone on Zoom as well.
and we have someone on Zoom. Yeah. Why don't we take our Zoom speaker, and then, did you still want to talk? Okay. So we're going to go with Kathy. Kathy, you're our guinea pig here, so thank you for participating in this way. Can you hear me? You're muted right now, but I think once you unmute yourself, we'll be able to hear you.
Okay. Did you call my name?
Yes, you're up.
Everyone can hear me well?
We can hear you well, thank you.
So, good evening. My name is Kathy Lynch on Rush Road. I'm the Westford Republican Town Committee Chair and the Republican State Committee Woman for the 1st Middlesex District, representing the city of Lowell and 5 towns, including Westford. I recently served 2 years on the Healthy Westford Committee. In speaking with colleagues and constituents, I am hearing very strong objections to mask mandates. I find it heartbreaking to see precious children with faces hidden, unable to breathe freely, and unable to see facial expressions that are vital for communication and child development. The mask is a cover that incubates germs, fear, and suspicion of others. Immune suppression, bacterial and fungal infections are just a few more unhealthy side effects of wearing masks. It is imperative that individuals be fully informed about the risks and benefits of any medical intervention, to include PCR pool testing, temperature checks, vaccines, quarantines, and masks. Parents or guardians should then choose whether or not their child will participate in the intervention. Without informed consent and the ability to opt out of any health intervention, a dangerous nanny state health tyranny would ensue. On June 9th, thousands of petitions from residents against mask mandates were handed to the state Republican Party. A resolution to change the governor's mask mandate to a voluntary mask advisory was passed unanimously. The governor lifted the mask mandate this summer and is now only making a recommendation about wearing masks if individuals so choose. This is good advice, because no law or policy should interfere with the free will of our citizens to make their own health decisions. I call on the school committee to reject any mask or other medical mandate, or simply set voluntary advisories. Declared health emergency orders should never bypass our right to choose a health intervention that contains risks, and no one should be coerced, harassed, or sanctioned because of their health decision.
Thank you, Kathy. Okay. You're up.
Okay, I'm Joaquin Gargolov. I'm from 13 Bradley Lane here in Westford. And at home, we're all fully vaccinated. So since we are fully vaccinated, we are living life almost as normal without masks. Everywhere we go, no masks. So I'm strongly opposed the mandate for vaccines. It should be optional. It should be up to the parents. If the parents want the kids to use it, fine. If the parents don't want the kids to use masks, that should be also fine. Thank you very much.
Megan, and then you in front of me.
Hi, Megan Eckroth, Timberley Lane. I too, my whole family, thankfully, is age eligible and fully vaccinated. I had the privilege of being a full-time teacher in one of our classrooms in Westford from April 2nd, when we went back to school, until the end of the school year. Our goal as a district has been and should continue to be to offer free and public education to every single student that lives in our district. I know you're not making any of these decisions tonight, and I didn't intend to speak, but listening to this, I think I maybe sat in the wrong part of the room. So I'll just say that the CDC has very clear guidance that unvaccinated individuals should strongly, they should wear masks. And someone had said, oh, if, it should be a parent's choice, and teachers can choose. I can tell you that the stress that I saw from kids, or the relief rather, was to be able to come to school. There is no contingency plan from DESE or our governor for remote schooling. There's no contingency plan. So if parents choose and they think it's their free will and, oh my God, don't mask my child and they can't breathe and everything that Kathy just said, which is largely untrue, want to send them to school without masks, what is going to happen is that probably COVID's going to spread and those children will have to quarantine and they can no longer be educated in our system. In addition to that, in giving other parents the choice, you are removing that choice from parents and families of the most vulnerable students and families that need and deserve the same equitable access to our school system. So lastly, I'll just say that I appreciate that you're following the science and the data, and I hope that we can hear as we get closer to what the decision is, which again, I imagine is fluid as this has changed so much from our staff. I think that we owe that to them. They probably are largely vaccinated. They're eligible to be vaccinated. But that was what was so important, especially for those younger kids, was to see their teachers' faces. So I'd like to know how our staff feels. And my only other question would be as far as the accruing more data. That data is from summer months where many activities have been outside. Many families and children have largely been hanging out or socializing with families they see regularly. We're talking about indoors with all of our students mixed together. So I would just, of course that data is important, but I think that data is liable to change when the whole environment changes.
You were next. And I just asked, when somebody's speaking, nobody else comment so we can hear the person speaking? Thank you.
My name is Ade Daniel. I'm at 5 River Street. I'll have one of my children in Westford this year for the first time. And I just want to emphasize that we, us as a community, are educating our children together. So we have to also keep each other safe together. Not every person can be vaccinated. They're too young. I have immunocompromised family members who would be exposed if my child brings the virus home. So it's not something that we can decide on our own for ourselves. It has to be done collectively. We know that this new variant is very easy to pass along. Vaccinated people can pass it along, can carry it. We just cannot ignore and say, it's about my need and my family's need only. No one wants to wear a mask all the time. I want to see smiles, faces. My children would prefer that. But because the reality requires that we have to be safe, we wear our masks. it is important that we make sure we take the precautions out there for us. Masks, social distancing, vaccines is what's available to us, and we have to make use of it. Thank you for your time.
Thank you. I don't know who was next. Well, I'll go with you.
Thank you. Two-minute time frame. I'm going to read fast. I apologize. Travis Rowley, 22, Newport Drive. So the case against masking our kids is pretty simple, but it's also the superior position. 4 quick points. The risk that COVID poses to kids is extremely unthreatening, and this remains true with the emergence of the Delta variant. Our own Westford Health Director, Jeff Stevens, had this to say just a couple of weeks ago: Delta doesn't appear to be any more deadly. He's right, just check with the CDC. Number 2, masking a child for hours at a time, 5 days a week, is obviously detrimental to his health. It obviously cramps his social and educational development. I'm looking at 3 physicians right here invoking, quote, research that shows that a moist mask is a breeding ground for bacteria and fungus, which can undermine mucosal viral immunity, reminding us that the World Health Organization, mentioned several negative aspects of frequent long-term masking, namely claustrophobic experiences and difficulty getting sufficient oxygen, which leads to an increased heart rate, nausea, dizziness, and headaches. This is thousands of students across the country experiencing this. Skin problems, sinusitis, fatigue. Again, obviously, it all starts with breathing, which you can see I'm having difficulty. 3, the reassurance that some parents feel by forcing all children to mask is unscientifically misguided. The masks don't work anyway, not nearly as effectively as we've been told, especially when we're talking about hundreds of kids sharing hallways and classrooms for hours on end, disgusting as kids are, allowed to unmask when they snack and lunch with one another. Quote, we've all done a disservice to the public. Face cloth coverings, they actually only have a very limited impact. The studies show that an individual might get infected within 15 minutes in a room. If you add a face cloth, you only get about 5 more minutes of protection. So I've been really disappointed with my colleagues in public health for not being more clear about this. That's Dr. Michael Osterholm of President Biden's COVID Advisory Board just several weeks ago, rolling his eyes at masking. Lastly, we don't even have to agree on the efficacy of masking. Any adult still under the impression that COVID poses a threat to himself, a vaccine has been available for 9 months now. So what are we even discussing here? The kids are perfectly safe, and any adult still concerned with being infected has the vaccine. I agree with the excellent Wall Street Journal op-ed from a couple of weeks ago, quote, it's abusive to force kids who struggle with masks to sacrifice for the sake of unvaccinated adults. Thank you.
I think I had you in the back. Yeah, in the glasses, yep.
Hello, Liz Sherry, 10 Collimore Drive. I can see both sides of this, I really can, but I'm a person who likes to see the data. And recently, Dr. Fauci was asked, about masking children, and he said, and the data, and he said that there's none yet. Hopefully a study will come out soon. So it just is ridiculous. We've been doing this for 18 months. The CDC, Dr. Fauci, has no study available yet. So it kind of tells me something. Something's just not adding up when it comes to masking. And the other thing, I found this on the Mass Department of Elementary and Secondary Education website. This is regarding last year. The COVID case data in this report represent the number of positive COVID cases as reported to the Department of Elementary and Secondary Education by local education agencies, including school districts, charter schools, and collaboratives. In addition, the pool testing data reported are at the state level and represent the results of pool tests for the week and the length of the program. It goes on to discuss how this is reported. Many schools across the Commonwealth have been safely educating students in person since September. This is regarding last year. With very little evidence of in-school transmission in schools. Schools voluntarily self-report positive cases to DSC's COVID Help Center and the state's pool testing initiative also should suggest that a vast majority of positive cases can be isolated to one student or staff. versus spreading through in-school transmission. The state's Department of Public Health officially tracks positive cases in communities. Presently, over 99% of the schools in the Commonwealth are offering full-time in-person instruction. Students, all K through 12 grades, are estimated 735,000 students across the state are now attending some form of in-person learning, approximately 140,000 staff. With hundreds of thousands of students returning to school buildings, medical experts have forecasted that the number of positive cases reported to schools may increase due to the increased volume of students. The department will continue to follow safety guidelines and strategies, including pool testing, to help identify and isolate positive cases. In February, the DS...
We're well over 2 minutes.
Okay,
so
well, just one more thing. It just says...
Concluding point.
Mass majority of tests contain only one positive test per pool. Sorry, I can't speak well. And to date, out of all the school districts participating, incidents of in-school transmission among students and staff remain extremely limited. So this shows that it's not being transmitted in the schools. The children are not giving it to the teachers are not giving it to the students. So I support no masking.
Thank you, Liz. Okay, I had, I don't know which of you, work it out.
Hi, good evening.
Hi.
My name is Jennifer Zaheen. I live at 4 Magnolia Drive. I have my husband, excuse me? Oh, not you then. Oh, okay. I just came tonight. I think it's really important as a parent and a member of the community. I've written each of you, and my husband and I have reached out to each of you and provided lots of facts and information. In 2 minutes, I want to highlight some important points. Our kids are not vaccinated. They're the vulnerable population here. Please ensure that there is a mask mandate to ensure that our kids can go back to school and do so safely, both for the teachers and for the students, and for the families that they come home to. Cases are rising everywhere, including for our kids. Kids are not vaccinated. Cases in Westford do not matter since people travel and not all the staff is from Westford. The CDC's guidance is for school staff and children to wear masks and to social distance. The American Pediatric Association recommends masks and social distancing. Dr. Fauci recommends masks and social distancing. It seems very clear to me and to my family and other neighbors and friends who couldn't be here tonight that a mask mandate is the only way during a global ongoing pandemic that we can have our kids return to school, which I think is what everyone wants, but to do so safely. Please ensure the safety of our children. Thank you.
Go ahead.
Good evening. Erica Chilson, 11 Blueberry Lane, proud Nabnasset parent. Thank you for taking the time to listen to all our comments. You should vote for a mask mandate. Science dictates it. The CPA, APA, NHI, and Dr. Fauci all recommend, not to mention DESE, that kids should be wearing masks in school to mitigate the spread of infection. We are not here where we were last in fall or spring. The viral load in the Delta variant is much higher, and the rate of pediatric infections is soaring. It is simply not safe to have unvaccinated children inside the schools without masks. From the Globe, Dr. Francis Collins, the director of the NHI, said more than 400 children have died of COVID-19, and right now we have almost 2,000 kids in the hospital, many of them in the ICUs, some under the age of 4. So anybody who tries to tell you, well, don't worry about the kids, the virus won't really bother them, that's not the evidence. And especially the Delta being so contagious, kids are very seriously at risk. Given the children can't get a vaccine, masks are the most effective way to stop the spread of the virus. The kids are already used to wearing masks. Mandating masks will help avoid any possible shutdown and spread. Let's not also forget the teachers who have sacrificed so much. If everyone is masked up, they will feel safer, period. The decision of just simply recommending masks and letting it be to the decision of the parents is playing with the lives of our children. Kids will show up masked and unmasked. It puts social pressure on the kids and opens up the door to bullying. It ultimately puts the decision in the hands of our children, and the children do not need any more additional pressure. We all want our kids in school and to stay in school. Remote learning was not the best option. It's hard. I would rather have my kid in school with a mask, and I get it. We're all done with masks. Nobody wants to wear masks. But I'd rather have kids in masks in school rather than a school shutdown or a kid on a ventilator. We all want our kids to be in a safe learning environment. Keep them safe, mandate the masks. I do ask you, are you going to vote for the safety of our children? Trust science, learn what is going around the nation. Don't let Westford become a national story with even one child dying from COVID. Thank you.
Thank you. Eileen, were you gonna?
Hi, Eileen Tatro, Oak Road, and my pronouns are she and her. So I wasn't going to speak today at all, because you all have seen my emails and some of you have known my opinions. But I was stunned by what I was hearing in this room. So I just want to follow up here with, luckily there's places in this country that have started school before we have, and Georgia's one of those. An entire school district shut down yesterday, 2 weeks after they started classes, because at least 76 kids have COVID, because 150 are in quarantine. 679 students are in quarantine. 67 school district faculty have tested positive, and 150 are in quarantine, okay? And there's no remote schooling going on there. I mean, there's people who are sick here. They have shut down for 2 weeks. They have now lost 2 weeks of education. Hopefully none of these people will get sick. My daughter is 15. She attended summer school for performing arts this summer at WA. The rule was, in the building, except when you're having food, masks on. Even when you're in the middle of performing a play, even when it's 90 some odd degrees in those rooms. If you're outdoors on the stage or outdoors, you did not have to wear a mask, but they did encourage social distancing. They had one case all summer. We got one notification all summer. I'm looking at this and I'm thinking, kids there were 8 to 18. It's wide range. She's vaccinated, and yet we still looked at it and we saw that masks were working. And yes, it was awful on those 90 some odd degree days last week when she was in a mask. But you know what? She's not on a ventilator. Neither are we. And that's all I ask for, because my cousin, he was, and luckily he survived. My husband's aunt did not.
Thank you. Okay, I think we have time for a couple more. Try to make it new information, new comments. Go ahead.
Thank you very much. My name is Wendy Welsh. I live on Tech Valley Drive, and I'm really concerned about the authoritarianism that I see. People need to wear a mask. They should be able to decide. It's my body, my choice, which is what I've always, as a non-authoritarian person, I always thought that I get to decide, or I get to decide for my children. I have a really bad problem. My mother, when she had a vaccine, she got Bell's palsy. That meant half of her face fell down, okay? My now ex-husband's mother, when she got the vaccine, in the 1970s, she got the Guillain-Barré disease, which made it hard for her to walk. Now I'm in the situation that my children might be forced to get a vaccine. And that means that maybe they won't be able to walk. Maybe they will be disfigured. Maybe something else might happen, some type of autoimmune problem. And I am really concerned. The problem with me is that if we mandate these masks for the kids who are not vaccinated, my kids might, because I'm not an authoritarian. I'm not going to tell them not to get it. That's the way I feel. I will tell them why I think they should do something. I'm not going to tell them they should or shouldn't, because as far as I'm concerned, that's just not the way what you do to someone else's body. With the shame that might come with having to wear the mask when everybody else, when the unvaccinated are not masked, my kids might succumb to doing something to their body that really might damage them for the rest of their lives. And I would hope that, you know, you can take that into consideration. People are afraid. I can hear it. I feel bad for them. If they're really afraid, send their kids with the mask, right? If it works, it works. Have their kids get vaccinated. If it works, it works. It's not, I'm not holding them back from taking care of their children, but they are getting in the way of me taking care of mine. Thank you.
Thank you. In the front row, and then we'll go to you, and we'll cut it off there. Thank you.
Hello all, my name is Purnima and I live in Sherwood Drive. I have a small kid who's not vaccinated, and so when the majority of adults in this room who might have been vaccinated are required to wear masks today, why are our kids who are not vaccinated, who are more vulnerable, being asked not to mask? I can't understand that or comprehend that. And Westford is not in an isolated bubble. Westford's health department mentioned a couple of weeks back that all the positive cases in Westford have been because people traveled. And even vaccinated adults tested positive. So if there is an outbreak in school, how are we going to manage it? And then we have built this society, community for the past 1.5 years with utmost care, and all that efforts are going to waste if you're not going to wear a mask now. We lost a couple of family members, and after the loss, it's not the same. The family is not the same. We can beat this pandemic and protect each other only by masking. So I request you to please have a mandate for masking. Thank you.
Thank you. And you.
My name is Carrie Tonks. I live on Oak Road. I too did not intend to speak today. I'm not good at public speaking. So for me to be up here is I feel very strongly. And I would like to point out that we have over 150 people who have signed a petition that we can provide to you that do agree with us. Honestly, we're more likely in these children to die from the seasonal flu or to be hit from a falling rock from the sky. It's like 0.008% that they will contract the virus. And for the ones that do, I'm sure that they have some underlying condition and are ended up putting on ventilators. And ultimately, that is what is killing people, is the ventilators, my stepfather included. So it's not to say that I'm not, that I don't think that it can happen and that people can contract it. I just don't think that mandating a mask on a child for 6 hours or more of the day, especially if they have to go to after-school programs. And medical professionals have to wear masks, right? They are professionally fitted for those masks so that things do not get in and through. The masks that children are forced to wear are able to get those virus droplets inside. Bottom line, it just should not be a mandated decision. It should be choice by parents. And if you have an underlying condition, then you wear the mask. And it's not to say that our children are more important or theirs are less important. This is for all children. And I have 2 in the school systems, and I will not be sending them in masks. Thank you.
So that wraps up our public comment. I just want to thank everyone for coming out and speaking. I know it's been a long 17 months for everyone. I know that people have concerns. I know that there's a lot of emotion around everything that everyone's been through. And I know that everyone is just looking out for what's best for kids. So I really appreciate it. I appreciate respectful listening. And like we've said, there's no vote tonight on any precautions, any mask mandates, anything like that. We'll touch on the timeline a little bit, but we'll be meeting again next week with a joint meeting with the Board of Health. At that point, there may be recommendations, there may be votes to determine what's going to happen once school starts. And so again, thank you. And we'll move on to item number 6, which is old business. Timeline for Westford Public Schools decision regarding DESI updated COVID guidance.
So I'll start by just saying it's ironic that it's old business, right? Because it is something that, although we have been dealing with this for quite some time, everything is changing, right? We thought we were heading in one direction in the spring, and then even into the summer, and then we have all the just different changing information. So you saw in the packet, I'd created a timeline for you because you were aware that we were having different conversations, but I thought it would be helpful for you to see when we had specific conversations and know that those are still ongoing, right? So I had said to families in my August 1st midsummer update that hopefully tonight we would be talking more about what school is going to look like in terms of the DESI guidance. And when I first met with Jeff Stevens, we talked about the fact that at that moment in time we were really only looking at 2 weeks worth of data. And so if we didn't want to make any decision based on 2 weeks worth of data. So we talked about the fact that waiting until next week would give us then 5 full weeks of our local data to be looking at. It would also give us time to look and see, as somebody mentioned, the impact that schools who have started all over the country might be going through for us to look at in different aspects like that. And so, so we're still continuing to meet. We're going to be talking this week as well, and then we've proposed the meeting for the 24th. So Tuesday the 24th, I invited the Board of Health to join us, because it's kind of a joint meeting, but it's really your meeting, and they'll be joining us. And at that moment in time, we'll have our specific recommendations, which we'll be talking about basically all in response to the DESI guidance, right? So the DESI guidance is written to me, to the superintendents, to the leaders of the charter schools, to the leaders of the special education schools, and it has very specific information in it. And that's what we're going to be talking about specifically as to what we think we should be doing based on that specific guidance. Additionally, one of the things that they talk about in their guidance is all of the different testing protocols. And so last year, we did not participate in pool testing as it was known at that moment in time for a number of reasons. We had talked about it, we had talked about the logistics of it, we had talked about it with our nursing staff in terms of if you don't have universal buy-in for it, it actually isn't necessarily helping you with that specific data. And so at that time we had decided not to do that. Well, the state has come out with other testing options and protocols, which I think is very interesting for what we'd be talking about. And so Dr. Cleary was able to participate in a webinar this last Wednesday, it's on the timeline, this last Wednesday about what this new test and stay information is. And so while this is still we're not necessarily making this recommendation at this moment in time, I want you to have this information so that then when we're talking about it with Jeff Stevens and at the Board of Health meeting, you'll have a little bit more information if you want to ask questions about Jewel. So would you mind explaining the different?
Sure. So as Dr. Chu mentioned, last year we were talking at length about pool testing, and Westford decided not to participate for several reasons, some of which Dr. Chu just touched upon. That option is still an option for this coming year. However, they have expanded the testing models, and they have added 2 additional types of testing options. each is discrete, and of the three options, they can be mixed and matched. And we did find that some of the additional options are interesting and certainly worth some more discussion. In addition to the pooled testing, which actually they've shifted the nomenclature, it's now routine COVID safety checks. They didn't like the connotation to the pooled testing.
Yeah.
They also have now available symptomatic testing, which first and foremost, if students are sick, they must continue to stay home just like last year, and so that has not changed. However, if a student develops an isolated or mild symptom, like a headache or a sore throat, they can, in school, be tested with a Binax Now test on site, and within 15 minutes they'll get a read, and if it's negative, they can stay in school. In addition to symptomatic testing, there's a third option as well. It's called Test and Stay, and much of our concern last year with absences, as somebody mentioned, there was not significant spread of COVID with the mitigation measures that were in place, but the close contacts and the quarantining certainly became an issue. So the Test and Stay option allows us to identify close contacts, and of course families as well. And then we would test these close contact students on the premises with Binax Now. And we would do that assuming that they have a negative test for at least five consecutive school days. And that way students do not have to go home if they are a close contact, and they don't have to quarantine. And the state is saying that there's evidence that this type of test and stay is as effective as quarantining. We do have an application process that if the superintendent and with the support of the committee does want to move forward with one or some of these options, we would have to complete an application that includes a state of assurance, student and school information, not specific students, just in general. Would have to select which of the test models, and certainly there'd be a consent form sent to all families as well. On the consent form, all three options would be listed, even if Westford only chooses to participate in one or two. It's one universal consent form, so if the leadership and school committee chooses to go in that direction, we would just have to be very clear in terms of communication that even though all three tests are listed, it may be some mixture of those. So it was informative. I think a lot of districts, their interests were piqued, and more information continues to come on those other options.
Follow-up question. Yeah, on the testing, two questions. One is, can you give a thumbnail sketch of the routine COVID safety checks? Just so people know, like, how often, how many students, how does that play out?
Sure.
Does anybody know? Do we know off the top of our heads?
Yes, so students who opt in to pooled testing would be placed together or pooled with between 15 and 20 other students. And the testing would be collected for those students and sent to get tested. If somebody in a particular pool of 15 or 20 students would come back positive, then all 15 or 20 of those students would be then tested individually to see which of the students triggered that positive response. So it would be that same.
I think they lowered the number to 10.
10, okay.
It's 10 students.
Thank you.
Yeah.
And there's also a second option that was added this year to that version of testing, and the district would have to provide which of these two options within pooled testing they'd prefer. But the second one that was added as an option for this year is that students, when they're doing their pooled testing, which would be done weekly, would swab twice. And then they'd be pooled together and sent off. If there was a negative reading, then we would send off the second swab, and they could test that second swab individually, so that the child does 2 swabs in each sitting instead of having to retest if they are in a pool with a positive read.
Got it. Thank you.
Sure.
And my other question was, you talked about the application process for these testing protocols, timeline on those, when would we need to put that in to have it in place?
Well, they specifically gave us the impression at first that it was just became available today, right? So that or when we could start the application process. And they talk about it as there's a priority for people who apply before the 20th. However, it's available to everybody. So there is no that was one of the things we were concerned about, was that was there a cutoff? Was it only going to be a certain number of school districts that we're going to have? And no, they actually there is no cutoff. So I really need to get more clarification as to why they say that there's a priority deadline of August 20th. Maybe it's just about getting things in order before school starts, and they can't guarantee it if you didn't before then. That might be what that meant, but.
Okay.
Yeah.
Other questions from the committee? I see Alicia.
So one of the concerns last year with the pool testing was when they first rolled it out, the state was paying for it for the first, I believe it was 6 weeks, and then districts would have to assume it. And we weren't quite sure if ESSER 2 funds were going to kick in at that point. Will there be a direct to the district cost associated with this?
No, the state, the commissioner has assured us that they're taking care of the entire cost.
Excellent, for the entire year.
Yeah, for the entire year. So there isn't right. They talked about, and then eventually they would give it to us, but they're saying that they would cover the cost.
Great, thank you.
Other questions? Catherine?
I know this isn't related to testing, but I just wanted, when we're talking about the guidelines and knowing we have a meeting coming up next week, I know we're talking a lot about kind of protocols, health, medical testing, masking. In terms of social emotional well-being, I think it's one thing that maybe we're not talking about as much, and I think as important. As many parents spoke tonight, anxiety has, been an issue for many students of vaccinated, unvaccinated, depending on ages or whatever. I'm just wondering that along with all of the preparation and timelines that we're doing and trying to figure out what school looks like in the fall, are we talking about any SEL kind of programs, policies, procedures, aside from the extra adjustment counselors that we have coming in, that we're hoping or planning on implementing in the fall? And I particularly think about this in our poor K-2s who are now have spent their entire school experience so far having had COVID impact on their education. So I'm just kind of wondering where we are on that kind of aspect of it.
So first of all, in the biggest picture, SEL is our first priority, right? And so that's that's a message that we're actually talking about with all of our staff. And so as we're going over the leadership over the 2 days, and we're talking about equity, and we're talking about social emotional learning, we're talking about how those two things are connected. And so what does that look like as we start the school year? And my opening day is going to be talking about a great deal of that with our faculty, reminding our faculty that the relationships that they're building with every individual student is the most important foundation to the student success in the classroom. And so we're specifically attending to that in so many different ways. So it's really beyond just, you're right, the adjustment counselor, and is this going to help this group of people? We're talking about, we want to make sure that all of our adults in the building are attending to that and focusing on that district-wide.
So we don't have any talk of specific programs or anything that might be class-based that could be used?
Well, it depends on the different age levels, right? I mean, there's a number of different SEL strategies and specific lessons that some age groups have used that others, that was all age appropriate, right, in the first place. And so we're looking to make sure that everybody has the resources that they need. There are some things that we looked at that where some, I think, that was available for the middle school that wasn't necessarily used at the elementary level, and yet there is age-appropriate information that can be used if we provide those resources. And so we're vetting that out as well too, to make sure that what we're not doing is just taking a curriculum of SEL and putting that on the teacher's plate. So we're looking to see if there's specific lessons for the classroom that we didn't have that would be useful. it is something that we've been doing for a long time, right? We've been talking about being trauma invested in our district, and at the time, then we're hit with the pandemic. And what it's done is it's really reminded everybody that there's an increased amount of trauma here, right? And so all of those strategies and all the things that we've been talking about, they now need to be able to apply it to everybody, if that makes sense.
No, it does.
The short answer of, do we have like a specific program? No.
Okay. I mean, as long as, the teachers are feeling confidence, I think there's something to be said for a lot of class-based SEL that maybe is a little bit more focused and targeted this year, because the other thing is anxiety looks different in every kid, and I think we spoke about this as well, and some kids act out, some kids go into themselves, and so I think maybe it's something that for class-based to make sure that the teachers have specific tools, that we just kind of do look at doing kind of some class-based approaches that are maybe more specific, but are the same that is happening. What's happening in NAB is happening in Abbott, is happening, or Blanchard and Stoney. So I would appreciate maybe if there's a little bit more clarity on that. And I speak as a parent as well who has kids who suffer differently from anxiety. So,
sure.
And as a teacher, I know as well that there can be good, solid tools out there. So I'd love a little bit more clarity on that if we can get it next week. That would be awesome.
Sure.
Thanks.
Do you have other questions, Catherine?
No, but I'll take
Well,
more
I
if you
was
want.
just going to follow up and say, so I feel like last year, and I don't know the ins and outs of how we handled it, but there was at least a tacit understanding with the faculty, if not like a explicit understanding that things were going to be altered to attend to the social emotional health of students, given everything, right? There was sort of a decreased pressure in a lot of areas. There was a lot of leeway, a lot of flexibility about making sure kids had their social emotional needs met. Now, I don't know if that was done, I don't know how structured that was, sort of top down, but do you envision that your communication, to the curriculum coordinators, to the staff, will look somewhere in between last year and, the 2019-2020 school year, which is to say, we still want to pay special attention given last year, given that we may or may not be doing things like masking, depending on how that gets decided. But how do you envision that communication with staff will go as far as attending to the social emotional needs?
I mean, I can't stress enough that I'm making it very clear that is my priority, and it is the expectation that we are sharing that information with our entire leadership so that we are not adding additional stressors onto the faculty, right? And that we're trying to remove things that have been getting in their way, that it's made it impossible, if it was impossible for them to be building these positive relationships. That is the heart of it, right? And because it is about the individual child and the relationship, so that, to Catherine's point, if children present differently, right? And so we really need to be getting to know the children that are right in front of them. The benefit is that we're not going to be dealing with remote scenario, which I think our teachers did an excellent job trying to maintain and create, I think, relationships even remotely. They all want to be back in person in order to be able to do that and do that best. And we want to make sure that people aren't just like, oh, we're back in person now, so we don't have to put as much effort, right? Like, that's one of the things we're going to be talking about. Did you want to?
Right. Yeah, and certainly there are tools, and last year our counselors got together to collect a series of tools and provided the staff members with a website to access different types of openers, different types of do now that really foster community building and feeling comfortable and like you belong in class. And we'll continue to highlight those, but really what has been happening even pre-COVID, and I know that we need to pay extra attention because the volume is greater for some students, even just the magnitude for individual students is greater. But more than the tools, it's the skills of the teacher. So what we don't want to do is say, we're going to add another 20-minute block of the day to, in a discrete way, teach these particular SEL skills. We want them to be really embedded. When they're doing math, they should be doing SEL first. And not meaning prior to the math part of the block, but meaning in their thinking of structuring their math block, it needs to be about having full access, and that means socially and emotionally as well as academically, available for all students. And so kind of that type of embedding, which is more difficult, it's more skill-based than it is here's a curriculum or here's a list of tools, which there are great ones out there, to your point, and we'll bring those in. But we really want that on-the-spot connection and communication, because whether it's COVID-19 or whether it's a student coming to school hungry or from an unhealthy home for other reasons, or the loss of a pet or the loss of a loved one, we have to be equipped for all of this, pandemic or not. And so now we're collectively going to come together to bring it to, I think, a higher level district-wide, because we know that we have more students who will be coming and, you know, having some additional anxieties coming back to school.
Can I just follow up on that,
Yeah.
Chris? I completely agree with the long-term outlook. I just wonder, is there something more immediate that we also might need to look at? Because we know we have kids going back into the classroom anxious for whatever reason, and that, you know, it maybe doesn't have to be a program. Maybe on a K2 level, we just say we're doing extra extended recess, or so what. It's more to kind of formalize a more immediate response for dealing with COVID when we come back, aside from the long term, because I completely agree. I think everything you said, Carrie, is spot on. I just kind of wonder, is it something that we maybe could look at a little bit more based on how things went in the spring and some experiences I know of? I don't necessarily know if that was happening in all the schools. I think we kind of reverted back to, in some ways, everybody's back in class. We're trying to create normalcy, but the spring wasn't normal for so many reasons. And I think maybe we lost a little bit of that awareness of what extra can we do. That's not forever, and that's not necessarily the long term, but what can we do right now?
Sean?
Chris, I know you touched on this. So when do we have to decide on these 3 testing options? The suggested date you were saying?
The 20th.
The 20th,
Yeah,
okay.
is when this the priority deadline.
Priority, okay.
Yeah.
Yeah. So I guess that's what I'm confused about, because I'm looking at the, what was it? It was one of these documents that you were going to meet with the WPS head nurse on the 24th.
Yeah.
Like, does that put us in a compromised position, or, like, I guess what's the game plan after that? So what, the meeting after the 24th, you would then come to us and say, you suggest plans A and B, hypothetically, but maybe not C or something, and then what, we'd vote on it the next meeting? Okay.
On the 24th.
On the 24th, okay.
Presumably.
Yeah.
Is there, I mean, is there harm in applying now, this week? So
Well,
we get the priority
that's actually what I'm honestly just not sure about, because I wanted to apply so that then we have that option whether we decide to utilize it or not.
Yeah. I just
This is what I would like to see happen.
I wonder, are we putting ourselves in a compromised position? Because at the beginning of the meeting, we said, hey, look, you know, we're going to try to not vote on stuff until we've had 2 meetings to discuss it.
Right.
But I think the superintendent choosing to apply is different from a decision to implement, right? So I think as long as they're not going to come and swab against our will, I think it's safe to apply. And then
Yeah, and we'll be clear that everything requires parental consent.
Yeah.
Right? So the entire process requires parental consent about being tested. The difference could be if someone didn't want their child to be tested, then they might need to quarantine, right? So in that case, if the district decides to do that, parents would still have the opportunity to decide whether they wanted their child to participate in that or not.
I mean, I would say it's similar to like an MSBA project where, sure, we vote at certain gates of that process, but certainly there's preparation being done at your, you know, discretion to make sure that things happen in a timely manner. So I certainly would support doing the application to have the option.
Yeah. As part of the application process, do you need to tell them which of the 3 options you would want to go with, or are you just saying I'm applying for the testing process?
Yes, I believe we would be articulating.
You would be articulating, okay.
What we would be interested in.
Valerie?
I had another COVID sort of start of school question. When do you think we're going to know a little bit more about what lunch will look like? And like, just to kind of give parents an idea of like classroom setups, are they going to be like the spring? Are they going to be more like pre-COVID? Those kind of logistical things, is that for the 24th, or do you have more information on that tonight?
Well, so the physical environment of the classrooms, all of the restrictions in terms of the students had to be facing one direction, the desks had to be further apart, that's all been that has all been, I just lost the word. Lifted, thank you. So our plan, and the principals are planning that our classrooms are going to return to their flexible spaces, right? So that the students are going to be collaborating. They're going to be in using basically the majority of our classrooms have been flexible, which is why the restrictions of the COVID setups was so difficult in the first place, because it changed the entire environment. So that experience, what we're really talking about is masks and testing, not that things are going to look different for the student. The students are going to be changing classes, right? Where they would, right? They're going to be able to be utilizing all the different spaces in the building as they would typically. So to your
art room,
like the art rooms, yes, the different grades that would be moving to different places where they weren't. That's going to all return. Now, what our lunches look like, we're talking about that, right? So we're talking about that. That's something that the principals have been talking about. The idea that we still, one of the benefits of last year was the amount of time that our students got outside, right? And so that's one of the things that we're like, we really should be continuing to support that and encourage that. And so whether or not, depending on if there's a mask mandate, if there's not a mask mandate, the idea of what lunches might look like could be different in different grade levels, right? Whether they'd be returning to sitting at the desks in a cafeteria, or whether like they would be eating outside, right? Those are the different things we'll be talking about, and that we will have, because it will be in line with what our recommendations are, right? So we'll talk about it a little bit more on the 24th, but I think the major expectation is our clubs are going to be meeting. The student experience is going to be similar to what it was before in terms of their ability to move about and freely, depending on the age appropriateness of that, if that helps answer that question.
Yep.
Yeah.
Following on Valerie's question, so how about like orchestra or band or singing? How does that change for those programs?
So again, the restrictions that existed have been lifted. So at this moment in time, I don't believe that they haven't created new expectations for band and singing. Orchestra was different in the first place because orchestra we have a vibrant orchestra program. It didn't have the same activity that singing and playing a brass instrument does, right? So there really wasn't restrictions in the same way for our orchestra students to be in the room playing. It was more of the wind instruments and the singing that had different restrictions on them, but those have been lifted in terms of having different expectations than another content area. Would that be the safest way to say that, right? Because I mean, in general, it's the same as everything else.
Can I just check then, Dr. Chu, regardless of whether we go back masked or unmasked, all of that stays the same? Like when you're talking about lunchrooms and classrooms all looking like you're speaking about now, that doesn't change if we're unmasked versus masked. Do you understand what I'm asking?
I think I do.
Sorry.
No, I think I understand you, and the answer is yes. Like what that's why the question and the data and the things that we've been considering and looking at is whether or not we're going to require certain population, the entire population, to wear a mask inside the buildings. Which is one of the reasons why I kind of talked to the principals, just in terms of the more you think about being outside, then specifically for lunches, then this has no impact. The decision would have no impact.
Gloria, did you have any questions?
Thank you, Chris. I think my question was what the process will be for getting notice out to the public that we will be meeting with the Board of Health. People aren't necessarily used to seeing us on a Tuesday night. They're used to seeing us on Mondays. Will this be, will the agenda be a joint agenda? Will it, if someone subscribed to school committee agendas, will they automatically get it? Just what will the mechanism be? Because clearly there's a lot of public interest and concern about this issue, and I just want to make sure that the public that decision in conjunction with the Board of Health and how that information will get out to parents.
So I think, and correct me if this is your understanding, or if this isn't your understanding, that it would be a joint meeting with a joint agenda, presumably posted to both committees' agenda sections on the town website, so that all subscribers to either committee would get that agenda. We can do like a billboard post, presumably. We can try to get the word out as much as possible this week, so we're not thinking about it on Monday, informing the public, but trying to, the usual channels we have to let people know, do that this week. Does that sound about right?
Yeah.
And so everybody knows that there'll be a section for public comment during that?
Yes. And I think it will be kind of like a one agenda item meeting, more or less. We're not going to have regular business unless something crops up. It really will be to take this up. And also the policy we have now gives us a chance to get that in place as well. So it won't just be one, it'll be a low agenda item meeting. I guess it brings to question, what things do we think we as a committee need before going into Tuesday? For example, I had an example in my head and it just escaped me, but well, I would certainly want to know ahead of time, what's the WEA, what are the teachers saying. I'd like to know that before going in on Tuesday. Obviously, any updated DESI guidance, I don't know that there will be. Are we expecting anything?
I don't think so.
No. Any updated Board of Health, but I know we're waiting until that day because they're going to have the latest, so that may be coming. And then just maybe if are there any plans, like if there's updated guidance on lunch, that would probably help it. Because I think, for me, and I don't know if I speak for other people, saying everything's back to normal, says that sounds nice, but boy, I want to make sure we're doing this safely, and if there are things that we can do to make sure we're doing that safely, it helps kind of trade those off for me.
So I think Chris gestured to me because I had a parent ask me a question about the late bus, whether or not the late bus was running this year. And what I said to them was essentially what's being discussed and what will be decided by the superintendent and the committees that you're talking to is essentially masks, no masks. It sounds like almost everything else will be the same. So I think if we can come to that meeting on Tuesday with that decision, plus this is what transportation looks like, this is what lunch looks like, yes or no, your clubs, your sports, all these things will be running. And I know that we still need to hear from like Dole County on what their guidelines will be for sports, et cetera. But if we can sort of have that, like anticipate ahead of time all the questions that we've been asked in the last couple of weeks that we've had to say, well, we don't know, we can't tell you until you have the guidance. Because I did have a parent ask me about the late bus, and I said, I assume so, but let me follow up because I was not sure.
I just want to jump on that. I'd also add like kind of an update on where our status of our ventilation, like our HVAC stuff. And then another question I've heard a lot from parents is whether anything, I know, you know, there's no RLA, but whether anything will be offered if your student is quarantined. And I think those are, Gloria has her hand up.
And Gloria had her hand up.
Go ahead, Gloria.
Thanks. I apologize if this is a repeat because I'm not catching 100% of everything that's being said in the room. But you had mentioned, Chris, what information would be helpful before the joint board meeting with the Board of Health, and certainly knowing the opinion of our nursing staff and our consulting physicians, I think would be incredibly helpful. So if we can just add that to the list, I'm sure it was probably on there anyway, but wanted to make sure. Thank you.
Thank you. Those are good. Anything else? Okay.
Actually, hey, just briefly, this is related, but it's not. Do we, have we discussed what a procedure is for quarantine students? Like what level of services they're being offered at that point? I mean, obviously, like we had different cohorts last year. We had some people who were remote, some people who were hybrid, you know, because, you know, I'm thinking of these 3 testing things and I'm excited about all of them. And the first thing that comes to mind is that, you know, maybe it will alleviate some of the issues with our teachers having to create 2 lessons kind of, you know, for the folks who are at home versus the in-person learners.
Right.
Yeah, so let me go back to my original question. Have we discussed what the policy would be for quarantine students and what the teacher would be required to offer them?
A big piece of it has been waiting to find out exactly what DESE was going to require for contact tracing and quarantining information, which is one of those wonderful things that they had said, we'll get you that information later.
Okay.
Right? So some of that is now, they're now communicating that, so we need to look more closely at it to see specifically what are they expecting of our students in the first place. Yes, the remote learning program has been removed from being an option, right? In terms of a regular strategy for people to be able to opt for online learning. We now, though, get into typically if a student was missing school for an extended period of time, then we already had specific ways in which we would be supporting those students, right? So what we have to do is we have to look to see with the remote learning expectation or the remote learning option for the school to be using in order for it to count towards time on learning for students, we have to look to see, okay, well, what is possible? And it looks at, again, the age appropriateness of it, right? Because I think what's possible in one place is not possible or realistic in another place. There's also the difference between whether a student is able, because it's also the same for staff, right? So it's like whether they're able to be working or whether they're not because of their given scenario. So those are honestly things that we still have to iron out and get in place so that we can make sure that we're able to support everybody. And we're not receiving as much guidance in terms of the opinions from the state that we did before. Would you say that?
And we've touched upon this with the WEA officers, and so that conversation, I forget what date that was, last week or the week before, and so that conversation will continue of what that expectation is, but we are hopeful that whether it be through testing and some updated guidance from the state, that we aren't having we certainly won't be having the same volume that we had last year, but for the individual cases where it does occur, that's something that we're working out.
Thanks.
Alicia?
So Sean said the magic word, services, and I can hear my email populating now. I know you don't have the answer to this question now, but I can hear the parents of kids with IEPs and 504s who are receiving specific services. wanting to know how they find out what does a short-term or a long-term, like you said, a long-term quarantine, we're hoping we won't have that, but what do short-term and long-term delivery of services look like if your child is out for a quarantine, et cetera. So again, we always say that that conversation should be had with your team, but just alert you that that question will be coming, because I can already hear, well, if my child is out for 1 or 2 days, they might miss something on the service delivery grid, but if my child is out for 2 weeks, that's a whole different issue with the service delivery grid. So I anticipate that being a very big question too.
Yeah. I've got one last one. It's just food for thought, no discussion needed necessarily, but, and that would be looking at staffing and the need for substitutes. And I don't know if our substitute system has a helpful way of quantifying how we're doing, like what kind of margin we have as far as, boy, if we had a rash of quarantines and things like that, how we'd be doing. But just if you can come in with a sense of kind of how we're feeling about that, and if we need to, start putting the word out for substitutes, that would be really helpful too. We want to make sure we're in good shape at the beginning of the year. Okay. Any other questions? Gloria, anyone? Nope. Okay, thank you. That was more than we had budgeted, but I think it was really important that we got those questions out there. Okay, we're moving on to student enrollment update.
So it was amended. If you saw, there was a question because the original enrollment that went up, all of a sudden day school had a 5th grade classroom disappear, and that was just an error.
They were found.
So they're found.
Okay, good.
We found them. And so there hasn't been a significant change in the update. I mean, this is basically what we were talking about. We're not needing to add any sections or change any sections that we had discussed previously.
Great.
I mean, if anyone's looking back at our paper trail, the June projection, I think, had NAB 2nd grade at only 5 sections, but there was the paper trail shows that, but the discussion was about keeping an eye on that area. So that has grown to 6. And I'm noticing too that from our actuals in April of the K class at NAB moving to 1st grade, we grew like 23 kids there. So it's just interesting. I know we hear that like over the summer, right? We don't know who's going to move in. And obviously any families who chose like private K or homeschooled, then returning for 1st grade, that's proof of it in the numbers.
Right.
Yeah.
Other questions? Okay, great. Thank you for that.
I'm sorry, Chris.
Yeah, go ahead, John.
Chris, are we returning to an integrated preschool?
Yes.
Yes.
Okay.
Yeah.
So the enrollment's already started on that?
Yeah, that was taking place during the spring, yeah.
Okay, moving on to new business, item 7. We have a new policy, and today would be the first reading of that policy. Do I have a motion to waive that first reading?
Motion to waive the reading.
Second?
All in favor of waiving the first reading of the policy? Okay. So this is a policy. It's P5517. The policy subcommittee has drafted this policy in anticipation of the current state of COVID-19 or any future pandemics or, health emergencies. And so if you look at the rationale document, it gives you a little lengthier description of why and how. But in summary, a lot of districts, a lot of districts are putting in things like mask mandates and are writing specific policies in order to do that, in order to implement that, to back it by policy. The policy subcommittee took the approach that, the problem with that is that you are enacting and then maybe changing or rescinding as things change, and it's very specific to a certain moment in time. We wanted to come up with a policy that was a little more general, that let us, as a district, respond to any health emergency. And so that's what this does. Basically, it says that the school committee, bestows in the superintendent the ability to recommend certain precautions or measures to be taken to ensure student and staff safety in response to a health emergency. And then, in consultation with DESE with the State Department of Health, the Town Board of Health, and then the CDC, basically taking, and I know people had questions about using data and listening to the experts, and that's what this does. This says that we are going to listen to the experts. We're going to integrate all of that information, and we're going to look at that. The superintendent makes a recommendation. The committee would then vote on whatever measure the superintendent brings to us. And so it's general, it's applicable now, it's applicable in the future. And I guess the last thing I was going to...
Sorry.
Go ahead.
I just want to clarify that while certainly when you're talking about a pandemic, there are CDC suggestions that are processed through DESE and then guidelines come out. But also there are situations where something could be just relative to a particular school or a particular classroom. And that's nothing that, you could look to a big organization, state organization for, or federal organization. So that too would be an example of where the superintendent would have to make a decision that wouldn't necessarily come from guidance beyond us.
That's a great point.
So to clarify, something that came up in the policy meeting was a few years ago, there was a MRSA outbreak at WA, and it was upon the superintendent and the principal decided that the school would be closed for a couple of days to close it, to clean it, and then reopen it. So the point of this is to not prescribe a specific recommendation to the superintendent. The purpose of this is to give the superintendent, in conjunction with all of these other groups, in consultation, and with the requirement that they bring a report and metrics to us, to give them a more agile stance where they can respond more quickly to these things, so that they don't have to come back for an authorization every single time. And to clarify, there are a couple MGLs that are at the bottom of this, contagious diseases and school attendance and vaccination and immunization. Those are regulations that come down from the state. The state tells districts, you have to do this, and then the district has to have a policy that says, yes, we will do what the state tells us to. So that's not us deciding that we're all of a sudden going to start requiring a vaccination that the state is not recommending. That's us saying we will follow the law that the state requires, because the state charges school committees, and school committees charge their administrations with public health decisions and matters within your own district. It's literally part of our job. It's what we are when we take that oath in Patty's office. That's what we're saying. It's part of what we're saying we have to do. So what we're doing here is not necessarily anything we don't already do. We just wanted to make it very clear going forward for the next year, because it felt really unclear last year. While we were waiting for guidance and not knowing, we want to make the process clearer for people, because the more information you have, the easier it is to make your own family's decisions.
Thank you. And one thing I'll just add, and then I'll open it up for more comments and questions, is you'll notice that there's some strike-through text in green in the policy in the packet. Those are things, so the policy subcommittee met on some day last week, I can't remember, Wednesday maybe, Tuesday, I don't remember, and wrote the draft. And these were comments from council of recommended language changes that we did not have time to run through the committee. I just wanted to make sure that the subcommittee knew what the changes were. That we went ahead and put in there. So if there, and so the first one in the second paragraph, really the idea was that our wording before, I got to pull it back up, where it said the committee shall authorize and charge the superintendent. I think the sense was that sounded like an additional step, that we had to take a step of authorizing the superintendent to determine recommended protocols, versus the superintendent is authorized and charged with determining those protocols. So it kind of solidified that a little bit. And then at the end there was just changing the wording to make it more aligned with our typical wording on of accommodations.
Yeah, so I think one of the things I want some clarification on, I think Anisha mentioned like the MRSA outbreak. Like I'm thinking about like in a long pandemic situation, something really quickly happened in a classroom or in a school where the superintendent needs to act immediately, which doesn't actually cannot wait for the committee for vote. Well, he should be able to actually fully execute his power without any coming to a committee. So does this policy actually tie the superintendent's hand?
And that's something you raised as well.
Yeah. Right. Which that was actually the point behind creating this policy, was to eliminate that need for you to come back to us and say, I need to close one particular classroom. Because last year, though the district had that power came from DESI. And now what DESI and the MASS and the MASC are saying is every district needs to have their own individual policy that says this. DESI said it last year, we need to say it specifically. So we do want the superintendent to be able to respond in a situation like that, and I know it was, whether or not we need to tweak any wording, totally open to feedback on that.
Yeah, because it says like it shall be given by vote of the committee. So, but if the pandemic is over, there is no need. For example, every single year the committee has to actually vote to give the superintendent the authority to close down like a classroom or school because of some situation like emergency happen, right?
Right.
Well, I wonder if that's already covered elsewhere. That's something I don't think we've looked into. If that authority, I mean, it seems like that authority already does or should exist. I mean, certainly we have responded to more time-critical health situations without anybody, raising any concern. So I think it might be worth us looking to see if that's covered elsewhere. And if not, thinking about maybe an additional clause in here that talks about like exigent circumstances that, that really demand immediate action.
It does kind of go with the fact that in the third paragraph, the last sentence, the superintendent will hold that authority for the time frame determined by the committee upon authorization. So it kind of goes back into what is it that, is it the idea that it's established yearly? Is it established seasonal? Is it established at the time in which, we enter into a contract, or is it something that then, again, the committee is allowed to also then change that time frame and say, okay, we want information by this date or whatever the case may be. It's open.
Yeah, I do think that the third paragraph is a little bit problematic because it could actually tie the superintendent's hands.
Right.
Right.
And I guess what I wonder is if this maybe isn't meant for MRSA outbreaks. And, I think we wrote it more towards a pandemic versus that immediate need to take immediate action.
Right.
So I think it is worth us looking at what we have in place,
definitely.
and if we want to re-scope it a little bit. Catherine?
And following on from that, just reading the wording, it says in the event of a health emergency, we haven't defined essentially what that health emergency is. So maybe the discussion is, how do we define that more in order to, are we talking about MRSA or COVID or whatever? Right. So maybe it's worth looking at the wording on that.
Sean?
I don't think it's necessary. I'm looking at P1106, and the superintendent may close schools, blah, 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 on the basis of hazardous weather or other emergencies. So they already have that power. Okay. I think it's redundant if we add something.
And that is one of the policies that I said was a possible tag, but not necessarily, so we can tag it with that if that covers it.
And maybe, is there something we should do to make it clearer to draw a distinction between this and, that sort of kind of emergency that requires immediate action?
So backing up to process, usually our policies on policies say that we put up a policy at one meeting, we open public comment, we talk about it at the second meeting, we vote on it at the third meeting. We're being advised by DESI and by MASC and MASS and legal counsel that this needs to be in place faster. So we have a policy that says we can override that process. So what we will do tonight is we will take a vote on overriding that process to bring this forward at the meeting next week with the Board of Health. When we do that, we'll open public comment. We'll determine how long public comment will be. It will go up on the webpage for public comment, and then the policy subcommittee will meet right before we meet on the 24th. So either the morning of the 24th or sometime on the 23rd, the policy subcommittee will meet, take all of that feedback and see if anything needs to be tweaked, and then bring the new draft to the committee the night of the 24th.
Thank you for that.
Sorry, just for clarity, I thought the vote to shorten the timeline was at the next one, because we specifically.
Can we get Gloria to weigh in on that?
We could probably do it at either, but I think it's.
We wrote no vote on this agenda.
Okay, I may be wrong about that. Gloria, you want to weigh in because you wrote the policies on policies?
Repeat the question for me, Alicia. I heard part of what was said, but I didn't catch everything.
Do we need to override our usual policy process tonight in order to post and then have public comment close and meet before the 24th?
I think it would be clearest to take that vote tonight, because usually when we have in the past kind of amended our process, we do take that procedural vote to clarify when the public comment period is starting and when the public comment period is ending. And then that way we're giving the public notice that instead of our typical meeting process, we are using an accelerated process. So I think taking that procedural vote tonight is appropriate and gives the right notice to the public.
And to be clear, a procedural vote is not a vote on the policy itself. Therefore, it does not fall under the you need to put it on the agenda. It is part of the procedural process. It's a notification of the upcoming agenda. Okay.
So if
You'll vote on
That's what I was going to say.
Right.
You're not voting
The
on the
vote
policy.
will
Right.
be, yeah.
so if there is a procedure vote, does that actually give the committee or the public enough time to actually to read?
This is our business meeting, so we can take any procedural votes that are necessary to conduct the business of the meeting. So this is a procedural vote stemming from the item on the agenda. So it is appropriate. We're not
Correct.
taking a vote on the policy itself.
But to me, Jen's
No,
point-
my point is like, does it give like the committee enough time to read? Because I don't know like what's the new revised policy would be, and then you said that the policy subcommittee is going to meet like the night before or
Yes.
the night of the 24th, and that gives the committee what half a day or like 2 hours to read
Correct.
the new revised policy. Then really like or like 20 minutes before the meeting, that's going to be even worse. So how does the committee to be able to actually digest this, and how does the public to be able to digest this?
Asked, especially with the most recent Title IX update, because it was put forth by the state that we were out of compliance and we needed to bring it into compliance. And what we did was you publish on the webpage, you notify the public of the public comment period. Then you notify them of when the public comment period will close and deliver the policy to the full committee as soon as you can. So I would suggest that we open public comment, we keep public comment open through, we'll say Monday morning, so a week from now. And then the policy subcommittee should meet Monday afternoon and deliver the draft to the public, put it in the document manager. I was trying to say document manager and packet in the same word. That was not right. Deliver the revised policy from the policy subcommittee to the document manager on Monday, so that you have all of the rest of Monday, all of Tuesday, and then we talk about it Tuesday night. Because we can edit it Tuesday night. In process, we can edit it before we make any votes.
So Monday, Monday night or Monday afternoon, public will be able to see the revised policy.
Depending on when the policy subcommittee meets, yes.
But to your point,
And those are published meetings as well.
you know, to your point, our policies are designed to give sort of maximal public input, maximal
Correct.
committee deliberation, discernment on it. This is a deviation from that. But that is why we put in a policy that says you can deviate, but it does require 2/3 vote of the committee. And so if the committee doesn't feel like we should do that, that's why we take this vote. But I would say, given the nature of next Tuesday's meeting, it's probably best, I would vote in favor of doing this. And I will also say that it's unlikely that the bulk of the text of the policy would be changed. And so it's not like we're going to start from scratch. It would be minor. I would assume that the policy subcommittee would only be interested in doing minor changes that clarify, and solidify what we have in there.
Yeah,
And to
definitely,
be-
Sorry.
Sorry. To be very clear, DESI has told us, go figure out what you're doing and tell your public what you're doing.
Yeah.
So the policy does not let us do that or not let us do that. The policy clarifies the process. DESI has already said, figure out what you're doing, tell the public what you're doing.
That's true.
So the policy itself does not change whatever decision comes from the superintendent, the Board of Health, DESI, like all of that. The policy just clarifies how that is supposed to happen.
Yeah, so definitely given the time sensitivity and then the recommendation from DESI, and I say is like this needs to be in place before school starts. Right, so we have to actually accelerate the policy.
Right.
Gloria had a hand raised.
Gloria? Did you have a comment or question?
No, you already said it, Chris. I was just pointing out that, yes, it is a 2/3 vote for a reason. That's why we have that higher bar for suspending the policy process.
Right. So we think in a timeline of like, I guess I would ask Nina, how soon do we typically get a draft on the website for public comment?
It does not take long.
Like midday? Yeah, okay.
Okay.
So if we said like noon tomorrow through noon next Monday, is that what you were thinking?
I think that's good. And then so we're going to talk about subcommittee assignments this afternoon, later on in the meeting.
Yes.
Do those take effect immediately and we'll swap over to the next set of subcommittee assignments? Because then the question becomes, it was the three of us, but it would be Catherine, Gloria, and myself on the new policy subcommittee. So availability for meetings would be my question. So
Okay.
I would say.
I think we can be flexible on the subcommittee.
Okay.
If it makes sense
Yeah.
to switch over,
Okay.
then we do it. If for this one thing we want to
Right.
keep the three, then I think we can do that for a week.
And then we'll plan for the policy subcommittee in whatever form it is to meet Monday afternoon. And that's a posted meeting. That's always posted with 48 hours notice. And the public comment will close at noon on Monday. Policy subcommittee will meet Monday afternoon. The committee and the public can expect the draft, because we'll draft in the meeting. The committee and the public can expect the draft Monday evening-ish, based on when we end the meeting, so that you'll have it all of Tuesday to review before the meeting.
And this is why she's on policy subcommittee.
And here's the thing, we could get all the way to Tuesday night, and all of us could look at it and go, nope, we need to scrap this and rewrite it. That's how policy works,
Yep.
so.
Okay.
Exactly. So do I have a motion on this timeline?
Want me to say it?
Yep, I do.
Motion to override our normal policy timeline, to post this draft policy by noon tomorrow for a public period comment that will close on Monday, August 23rd at noon, and deliver the policy to the public by 8 a.m. Tuesday morning for a vote on Tuesday, August 24th at our next scheduled meeting.
Second.
Any other discussion or questions? This will require a 2/3 vote, so that would be 5 affirmative would make this pass. All in favor? Okay, that's unanimous.
Okay, so policy subcommittee will schedule a meeting for Monday for whoever that is at that point in time, and it will go up with 48 hours notice, as all of our meetings do. And that will probably be remote because it's during the day, so for people to be able to access it, it will most likely be remote.
Right. And Nina, if you need anything else from us, I think the version in the packet is what we would put up, but if you need anything, let us know.
And to be clear for
Thank
the
you.
public comment is on our webpage. If you go to the school committee tab, public comment on policies is there. You fill out a form, it goes directly to us.
Excellent. Thank you. Okay. The next item under new business is subcommittee assignments. This is very exciting. Did everybody see them? Is everybody happy? Can everybody live with it? I gotta say, thank you. I mean, when I first came on the committee, there was maybe one active subcommittee at the time, I want to say, or two, depending on what was going on. So it's just really impressive how much these 7 people are putting in and agreeing to lend a hand and get involved in all these. Well, I guess we did have more because we have the town one, but it's really great. I'm so appreciative of everyone's flexibility and willingness to just take things on. And so it's going to be a good year. I think we have people in really good spots. And, there is also, it's worth noting that there are other things that could pop up. So I would expect there could be a strategic plan subcommittee. What's the other one? Oh, we've had we've had the superintendent space utilization team before. That's something that may come back in some format, I would imagine, at some point. So there might be more ways to get involved, is all I'm saying. But otherwise, I just wanted to put it out there, thank everybody, and I think for the most part, it sort of starts today. It's by chair appointment. I've called this the official appointment, but I do think with policy, if it makes sense for us to do some sort of a transition, we can do that and work that out as well.
Grace?
Yes.
For the town committee, you do have to swear in.
Swear in, yeah.
Yeah.
Yes. So let's be clear on those, which ones those are. Capital planning, I assume Town and Safety Task Force will be the same. DEI, WestfordCAT, pedestrian safety. But you guys are already on the latter three, so that's good. But yes, you'll have to get sworn in. And if Town and Safety Task Force is continuing in some form, I will have to get sworn in for that one.
Yeah.
Thank you for that reminder.
And just for clarity, the only meetings that are posted publicly from our perspective are policy and finance, unless there's, like when the strategic plan and all that starts, that will be a whole other process. Because like Unit A is not a public meeting. CPAC is their own, they post their own meetings publicly, we send a liaison to them, and then the town boards post their own meetings. So if you're signing up for meeting notifications, you need to look at the town webpage and see what you're signing up for to make sure you're signing up for the correct notifications, because you won't always, if you just sign up for school committee meeting notifications, you don't get all of the notifications. You have to make sure you're signing up for specific subcommittees under their parent committee.
Exactly. Thank you. Okay, next item on the agenda, annual school building tour.
So, Paul, Fox, and I would like to invite you all to join us on August 24th at 8:30. Sounds awfully early at this moment in time.
Do we get breakfast?
8:30.
We gotta get back to that.
Coffee
For
break?
us to, we're going to focus on Robinson, Day, and Blanchard because of the different, first of all, with the accelerated roof project taking place at Blanchard, and then I think with different discussions about capital needs at those two schools, that's going to be the focus of our, we can, if there's something specific that you wanted to see, you can certainly, we can talk about that, but I feel like, you know, just from your own experience, that it's impossible to get into all of the schools in that amount of time in just one day, so we'll just kind of do that as a targeted focus, unless you have other thoughts that you wanted to share. That's what we were thinking, and Paul is excited to go with us and to kind of talk about the buildings with you from his lens, which I think will be really helpful.
Okay.
Sounds good.
Sounds great. That'll be a busy day.
Yep.
Is what we're saying. The 24th is sort of
24th.
circled in red on the calendar.
Yep.
That's the first school tour. Now, how about the other school tours?
Yeah, you're talking about like the come in, visit your classroom and stuff. Yeah, that's a separate one.
Okay.
Yeah.
So
yeah,
in
that's
the
different.
past, we've done multiple days and we visited every single building on different days. So I think what Dr. Chu is saying is this is the high needs buildings, the high info driven buildings, and that if there's other buildings you want to see for other reasons, we can schedule those separately.
Can we also potentially schedule like to visit the other buildings maybe later on in the year, like
Absolutely.
even in
Yeah,
end of
we will
September,
definitely.
Absolutely.
Yeah.
Absolutely. This is sort of this was the annual, like, this is what we're going to kind of look at and work on. But that's, one of my goals is to be in all of the buildings as often as I can. And so I think it would be great to then find other opportunities for you to visit buildings with me, or for you to visit them with the principals as well, too.
I think that makes sense.
Yeah.
And I think it makes sense to focus on these now.
Yeah.
Yeah.
But yes,
Yeah.
definitely we want to keep getting in there, because we certainly did more last year because of the big changes. But I
Last
think
year,
it's-
it was a lot about let's look and see what classes are going to look like.
Right.
Yes.
Right, and that is not our concern this year, right? Because the classrooms, I mean, it'll be nice to see them return to, you know, again, the flexible environments that they were in, but last year was a little bit different.
But it has been a priority to just, like you said, generally try to occasionally get in. And I'll have to go back and check how we did it, like the year before last. I don't remember if we
Years and
spread it
years
out
ago, it
or-
was one day, and then, I'm gonna be honest, that was probably me because I wanted everyone to go see the Reach classrooms in every building. When I first started, it was one day and like 3 buildings. And then we sort of increased it, and then last year was absolutely everything, including riding the bus so that we could see what that process looked like.
Oh, yeah, that was fun.
And we're sort of going back to what we did before now, and then we can figure out, you know, where we need to tweak it.
Yep.
Right.
But yeah, I'll miss the bus ride. That was fun.
Maybe we can get a bus to take us on Tuesday.
Right.
Great, thank you for that.
Thank you.
Okay, agenda item 8, personnel update.
Okay, so you have the list as of August 13th of our new hires. A couple of things that I want to highlight. First of all, I do want to pay special attention to the fact that you were aware that that we had appointed Melissa Boylan as the interim principal at Miller while Dr. Polbuck had requested a leave. She has decided to resign effective September 1st. So she's been with us for, I think this would be her 21st year. So we are extending Melissa Boylan to be the interim through the year. We'll talk in the fall. Part of my entry plan is going to be collecting all sorts of data from people. And so now, along with, we'll do the similar thing that I had said we would do with Stony Brook, right? And talking about gathering some different data and talking in the fall from then staff and families at Miller as well, before then we determine specifically then in the winter time what type of search are we looking at. And that would still be in that time frame. That would be a good time for us to be looking. So that is our plan with that. We also have Randy Knowles, who is our district-wide mail carrier. He is involved with all of our buildings, and he has decided he's going to be retiring, and that's made a lot of people sad to see him go, but we're very happy for him. And John Copley, who's the head custodian over at Blanchard, he at the end of the year will be retiring as well too. There was a correction. Originally, if you can see on the fourth line from the bottom, Elizabeth Zevalos. It has her listed as the reading interventionist, and that was the original plan, but a classroom position opened up, and she's been moved into the classroom position. So Ms. Dubois had sent something out listing her as a classroom teacher, and so Valerie had asked that question, and I was like, oh, that's a good catch there, because we needed to make sure that was updated on here as well too.
Alicia?
So I know that Melissa Boylan was slated to be one of the new combination student support leader assistant principals. So with her being the interim principal, what is happening to that assistant principal student support leader position?
Thank you. So we have hired Heather Newman, who was a special education teacher at Crisafulli, to be the interim AP. Okay. She has had experience doing that in the past as well too, and so she's moved into that interim position along with Ms. Boylan. Okay. And we have hired an interim special education teacher at Crisafulli for her spot.
Perfect. Thank you.
Yep.
Other questions? Okay, thank you for that.
Thank you.
Approval requests. So we're going to start off with the Valley Collaborative Board of Directors.
So yes, this fancy little paper here is you deciding to appoint me to the Valley Collaborative Board of Directors. The superintendent sits on that, and you as a committee have to officially vote to have me do that, and then you get to sign a piece of paper.
Which we have done.
If you decide to.
Going way back, so.
Right.
And the Valerie Collaborative Board of Directors. Valley, not the Valerie. Different people on the Valerie.
Wait, we can have more than one Valerie? Let's do that.
Right.
Okay, so I'll make a motion to appoint Dr. Chu to the Valley Collaborative Board of Directors.
Second.
Questions, discussion? All in favor? And that is unanimous.
I think, thank you. I'm not sure, I've never attended. Yeah, exactly. So that could be one that maybe I'd be like,
good luck.
Yeah, right? We'll see.
And the food service personnel contract.
Yes, this is the agreement with the food service personnel. I know that there was a question about the salary, the salary page, and if you look at page 25 for next year, it articulates a 5% increase, and that was in order to bring the first step up to the $15, because it was below the $15, so it was just for that year to bring everybody, to bring that step up to 15, and then it adjusted everybody, and then next year in the contract, it would go to the 2%. I see. If that makes sense.
Mm-hmm. Mm-hmm.
Okay. Are there any other questions about?
I don't think so.
Okay, so I will move that we approve the food service personnel contract running from July 1st, 2021 through June 30th, 2024.
Second?
Questions, discussion? Seeing none, all in favor? And that is unanimous. Thank you. Warrants.
Motion to approve payroll warrant number 2153 SP dated June 30th, 2021 in the amount of $383,343.99.
Second.
All in favor? Unanimous.
Motion to approve expense warrant number 2153 SE dated June 30th, 2021 in the amount of $434,284.64.
Second.
All in favor? That's unanimous.
Motion to approve payroll warrant number 2201 SP dated July 22nd, 2021 in the amount of $374,000. I just lost.
Go, do it again.
It's all good.
In the amount of $374,766.22. Sorry.
Second.
Completely shut
All
up.
in favor?
Been there, you're doing good. Hang tight.
Motion to approve manual payroll warrant number 2201 SM dated July 22nd, 2021 in the amount of $14,983.28.
Second.
All in favor? Unanimous.
Motion to approve expense warrant number 2201 SE dated July 22nd, 2021 in the amount of $776,652.53.
Second.
All in favor? Unanimous.
Motion to approve manual payroll warrant number 2206 SM dated July 28th, 2021 in the amount of $827.27.
Second.
All in favor? Unanimous.
Motion to approve payroll warrant number 2201 SP dated August 5th, 2021 in the amount of $252,974.70.
Second.
You said 2201, it's
Oh.
2206. That's the only, I was just correct that you,
Okay.
one digit off, but
And I second the friendly amendment.
Okay, great.
any other questions or comments? All in favor? That was unanimous.
Motion to approve expense warrant 2206 SE dated August 5th, 2021 in the amount of $206,037.50. Is it cut off?
Yeah, I think it's
Okay.
cut off.
Second.
All in favor? And that is unanimous as well. Beautifully done. That was a slog.
Quite a beginning. Motion to approve regular session minutes dated 6/14/21. Second.
Second.
That was Catherine with the second. All in favor? Okay, that's unanimous.
Motion to approve executive session minutes not for public release from May 10th and May 24th, 2021.
Second.
Discussion, questions? Nope. All in favor? Unanimous as well.
And Chair, a question?
Yes.
We have payroll warrants to sign for tonight? Do we? That was
I
actually a
haven't seen
question.
one.
There should be a warrant.
Okay. Well, after we adjourn, folks, stick around and let's look for the warrant to sign.
Okay.
We need 4 people to stick around to sign that.
Yep.
Otherwise, I will move that we adjourn.
I will second it.
Second.
All in favor?
Thanks, everyone.